So when it comes to cancer and just generally various health conditions that the human population faces, there's always a question of lifestyle, genetics, and how much each of these factors play a part in it. And we often ask when we fill out forms what your family history is in certain conditions, your hereditary sort of past. Well, how much does that play an impact? How much does genetics play an impact in various types of, we'll start with cancers in particular, because it's a big concern for many.
Yeah, no, that's a really good question. So essentially, we all carry the genetic code for cancer, okay, all of us in the population. And essentially, those genes, that genetic code that we carry is sort of locked in place by what we call suppressor genes. So they stop the cancer cells from growing. And then something happens either because of lifestyle factors or just by chance. And those suppressor genes are turned off, and it causes a rearrangement of genetic material that then causes the cancer to proliferate and present itself. So essentially, what the World Cancer Fund has shown that up to 50% of cancers are caused by lifestyle. So although some people carry genes that increase their risk of cancer dramatically. So the most common one that most people have heard of is the BRCA gene. So that's a gene that women may carry that increases their risk of developing breast cancer. So 80% of those women will develop breast cancer in the future. They've got an 80% chance. But for the rest of the population, we carry sort of low risk genes or medium risk genes. And then a huge part of it, whether we do develop cancer, is then based on lifestyle factors.
So talk us through that other 50%. Is there any way to predict this? Is there any way to understand your sort of potential risk? And then we can go into the lifestyle factors afterwards.
Yeah. So, there's extensive research that's being done in terms of looking at whether we can analyze genetic material to be able to see whether we carry any other genes that increase our risk of cancer. So as I mentioned, the BRCA gene is one of them. And there are about, a whole host of other genes that we know of that if you carry will increase your risk of cancer. And there's a trial going on at the moment, which is looking at whether we can do a blood test, and through that blood test, look at the genetic material to see whether we carry those genes. So that's not being used in mainstream medicine at the moment, but actually, there's a trial happening in the NHS back in October to see whether we could test to see if we test people through blood tests. We can see who are at higher risk genetically to develop cancer, and then really target lifestyle measures to try and reduce their risks. Because ultimately, if you've got the gene, you've already got that genetic predisposition, but you can focus a lot on measures to try to then reduce that risk in the future through lifestyle.
And how much of an impact can lifestyle have in that? If you've got a really strong predisposed risk, so let's say your parents have both had cancer, or you've had your uncles and grandparents, even if you've lived the healthiest lifestyle, are you still extremely predisposed to it? Or can we actually work against it?
So genetics do play a big part, and it depends on which of those, as I said, which of those genes you carry will determine whether you're extremely high risk or whether you're medium risk or low risk. So obviously, if you're someone who's got the BRCA gene, for example, no matter what you do, you've still got an extremely high risk of developing cancer, so 80% risk. So for those people, you're going to target your treatment very differently. You're not going to just advocate sort of lifestyle measures. You're going to maybe talk about, mastectomies and that sort of thing, because your risk is so high. But with people with medium risk, that's where you start talking about actually, the evidence has shown that if you've got a genetic predisposition, which is sort of a medium risk, you can delay the onset of cancer, maybe prevent the onset of cancer, and how aggressive that cancer is going to be through lifestyle measures.
Would these people get regular screening as well?
So what would happen is you would see a specialist and they would do a family tree to see how high risk you are, essentially. And then absolutely, if you're found to be someone who's, say, looking quite high risk because your mother had breast cancer, your grandmother had breast cancer, but say they haven't found the BRCA gene, then they may say, yes, let's do annual screening with breast mammograms every year to try and pick that up early if that happens. So it's so useful to have those conversations and to pick these things up early, because then you can alter your management plan essentially to specific for each person.
So do you say if you haven't had blood tests, looking at parents, grandparents would be the best way to determine or to get an idea of your genetic predisposition to cancer?
Yeah, so as of now, they're not doing, it's not a routine thing that's being done. But if through speaking to a doctor and they think, actually, yes, this looks like you've got a very strong family history because, as you said, your mum's had it, your grandmother's had it, then you'd be seen by a geneticist, and then they would go ahead and do specific tests to look for whether you carry those high risk genes or not. And not everyone does have that. So you may have a strong family history, but actually when they look at your genetic code, they can't find a particular gene that really massively increases your risks of getting cancer in the future. And that's when you'd also have the conversations about the importance of lifestyle measures at that point.
Those sorts of scenarios, go on, Ivan, go.
I was going to say, so even if you have a strong family history, there's still a chance that you may be okay.
Yeah, absolutely. So you may just be that person who's got a medium risk, or, in from the genetic side of things, it may still just be a medium risk. So, there's nothing you can really do about that other than really tailor your lifestyle to try and hugely lower that risk, have the screening more regularly, as you said, to try and pick things up early if it did occur.
Cool.
Because the evidence is 1 in 2 of us will develop cancer in our lifetime. That's a big number.
In those scenarios, would it be that, let's say that scenario of like your grandfather had cancer and maybe your grandmother as well, if they led a lifestyle, if they got it from lifestyle reasons, does that impact later on? Like, for example, if someone was smoking all their life, they develop lung cancer in their 50s and 60s, how does that impact later on generations?
Yeah.
If for example, how would that impact?
Yeah. So you pass on your genetic risk through subsequent generations. But if someone has developed cancer, as you said, through smoking, that wouldn't be something that then transfers through to subsequent generations. So the lifestyle, if your grandfather had a really unhealthy lifestyle, it's that genetic code isn't then going to be transferred to you because he had an unhealthy lifestyle which caused it.
Yeah. I mean, obviously that has to happen before the birth of the newborn, right? I think that's what I was going. Yeah.
So it's a good question.
It wouldn't just travel through it. Yeah.
It's a good question you're asking. That actually, if you get that, what you're saying is if that change happens before you then have your children.
Yeah, I think that's what I meant.
Yeah, that's a really good question. And as doctors, we never really that's not really something that we look into, because actually if it's related to lifestyle, it's a cumulative effect. So it's something that, over time, that damage accumulates over time, and then you develop the cancer. So that's why we always ask if someone's got cancer when they're young, it's more likely to be related to genetics. If someone gets cancer when they're older, of course, genetics play a part, but actually it's that cumulative damage that you develop over time that then subsequently leads to the cancer. So then that wouldn't be passed on to subsequent generations.
What would you classify as young when it comes to this?
Under the age of 50.
Okay.
Yeah. So usually and often, when it's genetics related, you get people presenting in their 30s and 40s, and that would be a red flag to say, actually, this doesn't seem that it's purely, lifestyle or just by chance. You've probably got a high genetic predisposition. And
when you're in that age bracket of 30s and early 40s, the last thing you think you're going to get is cancer. And sometimes you'd be quite resistant to wanting to get screened because you probably think you're too young, and also just the fear of knowing. How would you, outside of actually just getting regular screening, especially people in their 30s where screening is not really spoken about, what sort of signs do you need to be paying attention to? Or is it literally the family tree stuff, or are there other things you can be paying attention to that may think, okay, I probably should get screened?
So I think if you've got a family history of cancer, you're already going to be a bit more aware of it than the general population, because you've been exposed to it. What I always say is that, particularly when you're young, as you said, it's really important to know what normal is for you. Okay, so it's, when it comes to, say, testicular cancer is more common in young men versus as you get older. So, doing regular testicular examinations at home for women who've got, breast examination at home, it's really important for you to know what normal is for your body, because it's only when you know what's normal and you're regularly testing yourself will you be able to pick things up early to say, actually, something doesn't feel right. So I always advocate for young men to be examining their testicles, in the shower twice a week. Women self-examining their breasts, so important, because unless you know what normal is for you, you're not going to know when something feels strange. And the second thing is, if you notice a change or a new symptom that lasts for more than 3 to 4 weeks, it's really important to go and see a doctor, because often we ignore symptoms thinking, I'm young, I'm sure it's going to settle down, it's fine. There's no chance of me having anything, nothing like cancer, that's not going to happen to me. And of course, the risk is lower, when you're young, and it increases with age. But at the same time, if there is something that is new, that's persistent, it's really important to be seen.
Can you give some examples on that?
So, a simple thing like, okay, cough. So I've got a cough, it's been there for over 3 weeks, hasn't got better. That's something that you need to go and see a doctor about. Change in bowel habits. So, if you're someone who goes every 3 days, but now you're going twice a day, that's a red flag to say, actually, you've got a change in what's normal for you. That's persisting. You need to go and see a doctor about it. Obviously, things like a testicular lump or a breast lump, you need to go and see your GP about it. So it's really any change in your normal pattern, that's when you should see a doctor. And, they'll examine you, they may say it's all fine. But, one of the reasons why I set up Measure Health was because when working as a GP as well as in palliative care, I used to sort of look at the patient journey. And what often you see is that people did have symptoms for quite a long time, but they just never, they kind of just ignored it, assuming it's going to get better. And then often when they present, it's too late.
What sort of things are you looking for here? Is it like lumps, or is it other things you can, like, what about rashes and redness, and are there other things as well as lumps?
So obviously there's so many different types of cancers, and each cancer presents with its own type of symptoms. Lumps, yes, are important, whether it comes to breast lumps, testicular lumps. If you see a new lump on your skin, that's important to see. A rash on its own with no other symptoms is unlikely to be something worrying, but of course it's important to go and see someone if that's not getting better. But each specific cancer has specific symptoms to look out for, and there's a whole host depending on which part of the body you're looking at. I could spend hours going through that. On my website, I did a blog which goes through each of the cancers and what those symptoms are that you should look out for, what we call the red flag symptoms. So that's something that I would advise people to have a look at as well. But I don't know if you want me to go through each of them.
Just for the listeners, I was going to say, what about the key ones that maybe like the two most common cancers?
Yeah, so say we look at lung cancer. So number one, biggest thing is cough that's going on for 3 weeks or more. That's something that you need to have a chest X-ray for. So you should always go and see a doctor about it if you've got a cough going more than 3 weeks. New breathlessness, if you're struggling with breathing or you're just a bit more you usually run and now you feel a bit breathless after 10, 15 minutes, which is unusual for you. That's something that you should go and see a doctor about. Chest pain, particularly when you take a deep breath in, can be a symptom. Everyone's doing it now. But if that's new and persistent, again, you need to see a doctor about. And particularly if you've got a history of smoking, that increases your risk of lung problems. So if you're a smoker, and not just cigarettes, but shisha is a big one as well, that people say, well, I'd never smoke, but then they do shisha, quite frequently. Again, although that may not have tobacco, it's got a lot of other harmful chemicals that do increase your risk of getting, lung cancer in the future. So those are the main symptoms when it comes to lung symptoms. When you look at bowel, I mentioned earlier about a change in your bowel habits. So, if you've become constipated when you've not been in the past and it's persisting, or you've got diarrhea, which again is persisting for more than 4 weeks. You need to see a doctor about it. Unexplained tummy pain. So, grumbling tummy pain that you've sort of ignored for a period of time. If that's persisting, you need to see a doctor. Unexplained weight loss is another one. So losing weight without trying to lose weight. Bleeding from your back passage is another one. And again, people feel quite embarrassed to go and see their doctor about it. That they know they're going to have to be examined, but that can be a sign of something more concerning, and they need to be seen about that. And vomiting, unexplained vomiting, again, important to go and see a doctor about it. So I'd say those are the two for bowel and lung cancer.
So essentially, if you're getting weird symptoms for a long period of time, get it checked.
Yeah, exactly.
Don't just hope it's going to go away.
Yeah, exactly that. Know what's your normal, and then anything that's abnormal, you'll pick up quickly.
Ivan, you're on mute.
That's something that got worse actually during the COVID epidemic, wasn't it? With people coming forward, and that the rates of people getting checked dropped quite significantly, didn't it?
Yeah, absolutely. And that was a huge concern because referral rates dropped dramatically. So we know that we have missed people who were just too scared to come in to see us. And they haven't been referred on, or there were delays in being seen. So it's so important to increase awareness about what to look for and education. And there's been a huge NHS campaign to encourage people to come forward, advertising that's going on, because we know that people are scared. And I think they are still scared, particularly the older generation. They are scared to see their doctor and be exposed to lots of other people for fear of catching COVID. But it's just so important if there is a change, and even if you're not sure, it's always best to go and see a healthcare professional.
When it comes to lifestyle, how much, what things really matter, and what things may actually make a difference? Because you see all sorts of stuff come up in magazines and the newspaper. One on like the Times every week, there's a section called like Body and Soul, and there'll be like, blueberries now decrease your cancer risk by 57%. Like, there's always new things that are coming out.
Yeah.
What actually makes a difference?
You're right. There's such a plethora of conflicting information that it's often hard to know what to follow and what not to. I'd say the three biggest ones that are research has proven time and time again are, if you smoke, the number one risk factor for most cancers is smoking. So if you smoke, to stop smoking is the biggest thing you can do to lower your cancer risk. And it's a cumulative effect. So the more you smoke, the higher your risk is. So if you're smoking 10 a day, even by cutting it down to 5 a day, you're reducing your risk. Okay. And as I said, that includes shisha, vaping, they all increase your risk. So by cutting that down, that is the biggest single risk factor. Just
on that, for those listening who, maybe doing vaping and shisha as a lifestyle sort of Friday night, what are the dangers around there, and what potentially isn't spoken about? Because they're often seen as the safer options, and people go out with their mates and go for shisha or vape, whatever it is. What can you say to those?
So if those, often we think, oh, well, it hasn't got tobacco in it, so it's absolutely fine to do. But actually, particularly with shisha, ultimately there is still smoke being generated, and there's a significant amount of carbon monoxide that's being released. And that carbon monoxide, when you're inhaling, can still cause cellular damage. So, I think the evidence, like one large amount of shisha can be equivalent to smoking 11 cigarettes. So actually, I think there's often misinformation about that. As you said, it's sort of a social thing, and it's low risk, but actually that still is equivalent. The carbon monoxide that you're inhaling and the other chemicals can still cause cellular damage. So that is something that should be stopped if you want to lower your cancer risk in the future.
How quickly can the damage be done? Let's say when you were younger, you used to be a bit more recreational with your habits. What sort of damage can that do for you? I mean, stopping is obviously a massive thing, but can the damage already be done?
So as I said, the effects are cumulative. So if it's something that you used to do when you're younger, you've stopped, haven't done it for a number of years after that, your risk is significantly lower than someone who's been doing a small amount throughout their life. Okay. So So, if it's something that you do a one-off or once every few months and never do it again, your risk is much lower than someone else who does it regularly, because the damages that you get within your cells accumulate over time, and that's when you start seeing the changes that occur, which can present later on with proliferation of abnormal cells.
Sure. So you mentioned smoking. What are the other two?
Smoking is that. The second thing is exercise. So exercise is so essential, and the World Health Organization advocates at least 150 minutes per week of moderate to intense exercise. And that has been shown to lower cancer risk in the future. So often people ask, what exercise, what's the best exercise that I should be doing? And, there's no one thing that you'd say this one is better than that. The main thing is that you're exercising to a point where you're getting your heart rate up, a slight sweat, because that's what you'd classify as moderate activity. So, if you're walking, it should be a brisk walk, not just a stroll. So where your heart rate's increasing. Cycling is a great one. A lot of people, been doing that at home, the stationary bikes, cardio at home, but at least 2 hours, at least 2.5 to 3 hours per week has been shown to lower cancer risk in the future. And then the third one would be tackling obesity. Yeah, so obesity is a huge risk factor for cancer. And not to bombard you with sort of too much science, but essentially the way it's thought to work is that, when people are overweight, they carry a lot of fat around their organs. And when you've got a lot of fat carried around your body, it reduces, there's not enough space for oxygen essentially there. And with a low amount of oxygen in the body, that causes an inflammatory environment. And it's thought to be that inflammation in the body which leads to cellular damage, which, as I said, again, over time can increase your cancer risk. So tackling obesity is a really big thing, which obviously goes with the exercise through exercise. Reducing your BMI can have a huge impact to improving, lowering your cancer risk in the future.
Just on that,
I was going to say, what do you think of the health at every size movement?
I was literally about to ask that. Yeah.
Say that again. Sorry.
The health at every size movement. Do you think that's doing harm to this whole thing, or do you think it's making society better?
It's a really tough one. I mean, I think, when we look at the evidence is that, being overweight increases your risk for not only cancers, but actually for a whole host of other conditions. So diabetes is a huge one, high cholesterol is another one. So, if you're looking about having a healthy lifestyle and reducing your risk of medical problems in the future, having a healthy weight within a BMI of 20 to 25 is what, I would advocate that we aim for.
So yeah, we were discussing a couple of episodes ago around the health and every size movement, because there's, I don't know if you were familiar with the Cosmopolitan push at the start of the year, where they showed different pictures of different sizes and said each one of them is healthy. Mm-hmm. And our argument was, after a certain tipping point, probably either way, there's just no argument physiologically or scientifically that it can be healthy.
Yeah, I suppose it classifies what do they mean by healthy. What do we classify as healthy in terms of, are we talking about mental health or are we talking about physical health and medical problems in the future? Scientifically, if you're hugely overweight, you're really at risk of a number of health problems. As I said, not just the cancers, but diabetes, arthritis, you know, you've got pressure on your joints, and that, you know, there are a lot of complications that occur when you're overweight. So I suppose the question is, what's the definition of health? And how much did obesity play in the COVID epidemic? Do you think that was a big factor in letting it spread? Absolutely. I mean, you know, the evidence has shown that obesity was a huge risk factor for people. You know, those people that were overweight were much more likely to develop complications and resulting in intensive care admissions compared to those that weren't. And I think that was a huge wake-up call for a lot of people, because actually, you know, we talk about, you know, the cumulative benefits of doing the healthy, stopping smoking, looking at our diet, exercise, and those are cumulative effects that we can see over time. But actually, when it came to the COVID pandemic, people could see that actually, if I had a healthy BMI, I could reduce my risk tomorrow of having a complication related to COVID. So actually, I think it was a huge eye opener for a lot of people, the importance of having a healthy weight.
From your experience, have you found the COVID being an eye opener to actually have sparked action? So I'm sure with your line of work, you're giving this advice and laying out these recommendations quite frequently.
Yeah.
Do you find that the risk of it getting cancer or these other diseases is the trigger that a lot of people need?
Yeah, I mean, I think when it comes to dietary advice, it's often tough because people have to want to be receptive and want to have to make change. But when they're faced with something in front of them, diabetes, for example, you can get newly diagnosed diabetes, and you can say to someone, if you change your lifestyle now from today, in 3 months' time, you could potentially reverse your diabetes. And I see that happen on a regular basis, and it's wonderful to see, because lifestyle it's better than medication any day. Yeah, so the medicines can only do so much, but lifestyle is the one thing that you can do to change the trajectory of a particular condition, whether it is diabetes, whether it's arthritis and managing your pain, dementia. Yeah, it's a big one. So actually, we've seen that people who eat more fruit and vegetables, that cumulative effect can lower your risk of dementia in the future. So I think sometimes as healthcare professionals, we don't necessarily emphasize that enough. We're very good at sort of dishing out pills very quickly, but taking that time to really educate about the importance of diet. And sometimes, particularly in the NHS, we are so rushed to see patients every 10 minutes. That can sometimes be difficult, but taking that extra time to have that chat with someone can pay dividends in the future for them.
And then just looking at the people that do make those big changes and reverse that potential risk, do you find that there are commonalities between those people and the people that don't? Have you picked up any kind of signs or personality traits or anything like that with the people that do make those positive changes?
Yeah, I think it's education. I think it's people really fully understanding what, depending on what it is. But if we go back to diabetes, because that's such a huge one, and with the ethnic population as well, but really understanding that, the complications of what can happen if you don't manage this properly. So I think education is key, and the people that seem more educated and well read about a particular topic are much more motivated to do something, compared to others who maybe just don't fully understand what the risks are.
What about getting?
Do you want me to go? I was thinking, what about for people that they see the picture of the black lung on the cigarette packet, and they know that's killing them.
Yeah.
Yet they still like,
Yeah, you know what that is, that I can't answer. I wish I knew the answer to that, because that would be, the $1 million thing of it's so tough, isn't it? Because like you said, it says smoking kills on the cigarette packet. You see the black thing and they still go for it. And it's an addiction, isn't it? Like so many other things. It's the addictive quality of it, or, the association that, when I have a drink, I have a cigarette, and it's so hard to break that. And I think in those situations, often you need, you really need your handheld and some sort of counseling or support to break that addiction, just like you would do with alcohol addiction. Again, when it gets that bad, to really try and break the cycle, you need more support, and whether it's sort of cognitive behavioral therapy or somewhat, something to help you, because it's tough, to break that addiction.
Yeah, so it's more than just education,
Yeah, at that point, yeah.
What sort of, with regards to food, you mentioned the fruit and vegetables with regards to dementia. In your top 3, you said smoking, physical activity, and BMI, of which the last one obviously factors in nutrition to an extent.
Yeah.
Are there specific foods that matter here, or is it more just having a grasp of your calories and making sure that you use that to stay within a good weight range?
Yeah. So no, I mean, there has been evidence, a lot of evidence around certain foods that are particularly good as a group. So within fruit and vegetables, certain fruits and vegetables are slightly better than others, but generally speaking, increasing the amount of fruit and veg in your diet significantly makes a huge difference in terms of lowering cancer risk, dementia, arthritis in the future. And that's because of the accumulative effect of polyphenols in those certain food groups. So polyphenols have been shown to directly feed good bacteria in your gut and reduce the anti-inflammatory actions in your body as well. And those two things together cumulatively lower your risk of a number of conditions in the future. So, the 5 a day that the campaign of saying, minimum 5 a day is actually a minimum number that you should be hitting. And actually, evidence has shown is that the more you have, the better it is for you. So, in some countries, they advocate 10 a day. So actually, the 5 a day number just came about to allow it to be something that most people could achieve. But it's not what you should be hitting. It's the minimum amount that you should be having. So fruit and veg in general, but the brighter the color the fruit, they are generally they're richer in polyphenols. So polyphenols are the things that give the fruit color and an aroma. So blueberries, strawberries, green leafy vegetables, those are things that are really rich in polyphenols.
Eat the rainbow.
Eat the rainbow that my daughter's been learning about, my 5-year-old's been learning about at school and comes home and tells me about. So yeah, absolutely. But it's exactly that. And then again, and a high fiber diet as well has been shown to significantly reduce the risk of cancers, particularly bowel cancer. So, if you had to say what change you should make, you say increasing your fruit and vegetable intake, whatever that is, a high fiber diet, and reducing the amount of refined sugars in your body, because that again has been shown to, abnormal cells like sort of a rich, sweet environment, and that feeds the bad bacteria. So what you're trying to do is reverse that pattern.
For the if we just go back to the screening discussion that you had, you mentioned a lot. You talked a lot about self-examination. What's the difference between that and actually getting NHS screening? When should you do what? Or is there a time to know when to do what?
Yeah. So on the NHS, there's a national screening program, and that's where you have specific tests to look for early changes of cancer, sort of pre-cancerous changes. So if we go through that for women, you've got cervical screening, and that's for every woman over the age of 25, and that's done every 3 years. Yeah. For breast cancer, it's done over the age of 50. Every 3 years, you'll have a mammogram. So essentially, that's an X-ray of the breast to look for an abnormality. And then the third thing that's available is what we call a FIT test, so screening for bowel cancer. And that's done for men and women over the age of 60 every 2 years. So those are sort of specific tests that you're doing, looking for early changes related to cancer. And then obviously the self-examination you're doing at home is actually at that point picking up symptoms, picking up signs that so the screening is looking when you're completely healthy, but you're getting the test done. And then the self-examination you're doing at home is regularly testing, so you know what's normal, so that if you do pick up an abnormality, so that's a proper abnormality, that's when you get seen. So that's when you've got a problem, as opposed to screening, which is what you have done when you haven't got a problem. So picking up early, essentially.
Got it. Yeah, that makes sense. I think there's a lot of practical tips there, and it's great that you've reinforced a lot of our messaging that we've been talking about, and it's good to hear it from a doctor themselves.
Yeah, well, it's nice to understand the science behind it as well, isn't it? And as you said, sort of, it really does sort of reinforce a lot of what you advocate.
Where can people find out more about what you do?
So on my website, measurehealth.co.uk, I do sort of regular blogs, sort of health related blogs. So that's probably the best place to go, and then they can send me an email or give me a call if they have any other questions, and all the details are there. That's probably the best place to go to.
And what's your probably a question I should have asked earlier is, what's your personal reason for doing this? Have you got a connection to it?
Yeah, so I've worked in palliative care for over 5 years, and I've been a GP for coming up to 10 years. So I've seen a lot of people present with cancer and late stage cancer diagnosis. And I think I mentioned earlier that, when I used to always be one of those people that I'd sit and read through all the notes going back to the beginning, because I was always interested to know, how did this first present? Why did it take so long to get picked up? And, what you'd see is that people, as I said, had these sort of grumbling symptoms, but never really did anything about it because they're sort of non-specific. It didn't really fit anything in particular, and they just ignored it. And that's what really motivated me to set up Measure Health, which was, number one, to increase awareness for all age groups about the importance of things to look out for, when to seek help. And then also, to be able to provide a service locally, not having to go into central London, but a local service which is affordable for people, that if they do want to be screened early, not just for cancer, but for other health related conditions, that they've got somewhere local to go to, because that was something that I wasn't able to find. So those are really the two reasons why I ended up setting up Measure Health.
Fantastic. Just to finish up, if you've got relatives or family members who you may think are presenting symptoms, especially older populations, or you may have family members who are going through cancer, what are some of the best ways to support them and provide the right guidance in those periods? Because that can be very tough on a family.
It's really tough, and I think it's tough for the person going through it, of course, but as you said, the people around, and I think often they get neglected because you always focus on the patient and not necessarily the carers who are involved. And I would say it's just so important to go and speak to your GP, who can then signpost you to support services available. So there are a number of carer support networks that are available that your GP can refer you to. So I would always say that, first of all, recognize that you're playing such an important role, and that your health and mental health is equally as important, and seeing your GP about that.
Awesome. Thanks so much for coming on, Dr. Shonella. I think it was a real pleasure, and I think we were all much more educated on some of the risks and screening practices. I think that was a really important part of cancer and other health conditions.
That's great. Thank you so much for having me.